on a medication called methimazole. That's like the first and foremost treatment. And 4 to 6 weeks after starting it, we're going to recheck a total T4 only. Okay, not the free T4. But we also want to check a CBC, and we want to check bare minimum kidney, liver, and electrolytes. And that's because a lot of times the ALT is high, and we want to make sure it's come down, or the ALP. And we also want to make sure that we're not like pissing off the kidneys when we cut down on their blood supply because we're reducing thyroid hormone excretion. So methimazole is actually a drug that prevents the T4 from being excreted. So that's why it's really important to make sure you're checking everything, because you want to make sure that you're not hurting one organ or multiple organs by helping another. Another thing you want to watch for is that in very, very rare instances, I think I've seen it 3 times, you can get a really severe reaction and elevation of liver enzymes. And it's called an idiosyncratic. So like we don't know why it happens. We don't know when it's going to happen. And it doesn't really matter what dose. It's just a very rare subset of the population. Their liver really hates methimazole. And you're only going to catch that if you're checking the blood work. You also want to make sure that there isn't anything else wonky, like changes to the red cells, white cells. And then the kidney, you have to monitor closely because you don't want to send them into kidney failure by cutting back on their thyroid hormone. So we check it 4 to 6 weeks later, and then we can check it again at 3 months. And if there's no medication changes, then we check it every 6 months long term. And unlike the dogs, where we have to check it 4 to 6 hours post, in cats it doesn't really matter, because in cats it's suppressing the release of the hormone. And so we just want to make sure that at any given moment, really, there's not too much hormone. If there's any changes to the dosage, then we are going to want to check the blood 4 to 6 weeks after changing the dose. And for cats, you can give it as a pill. You can also have it compounded as a transdermal gel that you like put in the ear. And that one has variable effectiveness. Overall, it's pretty good, but cats are just like notoriously hard to pill. So it's sometimes can be a huge challenge, and it's nice to have an alternative. There is something called radioiodine treatment, which is basically injection of a radioactive isotope that kills any thyroid producing tissue. And sometimes cats can have what are called like ectopic thyroid tissue, which is basically just like, again, because they're aliens, just like random thyroid tissue in their chest or elsewhere that's also secreting thyroid hormone. So it kills all of it. And then they basically have to like hang out in a cage in this like lead lined I don't even know if it's really lead lined, but that's like little tiny room, and basically pee out radioactive material for 3 days. And then there's an assistant that goes in like all gowned up in biohazard stuff and feeds them. And so they have to stay there until they're no longer peeing out radioactive iodine, and then go home. And then a majority of them are fine. Like they don't need any therapy. You do some monitoring. A smaller population of them actually do require thyroid hormone supplementation, which is the irony, right? Because you made them like too hypothyroid. And you would think they would all be hypothyroid afterwards, but for some reason, most of them aren't. Like they just, even though it kills all the thyroid tissue, there's enough tissue somewhere, I guess, to produce enough thyroid hormone that they're fine. Before the invention / use of radioiodine therapy, surgery was something that people would commonly recommend. So you actually surgically remove the thyroid tissue. The problem is that if they have ectopic thyroid tissue, then it's not really doing anything because they still have tissue that's making too much hormone. And it's a pretty big surgery because, you know, in the neck, like there's a lot of vessels, there's a lot of nerves. So anytime you don't have to do surgery and you can treat it a different way, that's always a good option. There is a diet called YD made by Hills that is really, really low in iodine, and it actually has been shown to reduce thyroid levels. Sometimes it reduces them to normal, sometimes it doesn't. Not all cats like it, and if you have a multi-cat household, every cat can eat it, but cats that are not hyperthyroid, you have to then feed additional food that is not the YD to make sure that they're getting enough iodine. So the primary, in my mind, like the primary treatment options are you treat them with pills or transdermal, or you do radioiodine. And if you think you're going to do radioiodine, you have to prove that they're going to be okay with especially their kidney function when the thyroid is normalized. So a lot of times they have to be on thyroid medication for like a month or so before the places that do the radioiodine treatment will accept them. And then there's like a workup beforehand. You know, you take chest x-rays and repeat blood work and check a blood pressure and run a urine. But like I said, you know, they go in, come out 3 days later, and then they don't need pills anymore, which is pretty cool. The last piece of our wellness blood work puzzle is the urinalysis. So we use the urinalysis to help us determine in part what the urine concentration is, and that can help us to find out if there's kidney disease. We look to see if there's protein in the urine. Sometimes there can be casts, which are basically like the lining of the kidney, and we'll talk about that in a minute. And we can also diagnose diabetes, so if there's glucose in the urine plus high glucose in the blood. Sometimes you see ketones, especially if they have something called diabetic ketoacidosis or just ketosis. You can see crystals, which may be indicative of bladder stones. You can see urinary tract infections, sterile bladder inflammation, and sometimes you can actually see abnormal cells that can suggest bladder cancer. So what do we need? We need 1 to 12 mils of urine. And that doesn't sound like very much, but if you think about it, 12 mils is almost a tablespoon, which from like a cooking perspective is not very much, but from a urine perspective is a lot, because normally in veterinary medicine we draw about 3 mLs of blood for our kind of routine testing. So we don't need very much, and a little bit goes a long way, if you will. We'd like to ideally read it within 30 minutes of collection. That's frequently not possible, but that's our gold standard goal. And if we're not going to be able to read it for at least an hour from the time that it was collected, it should be refrigerated. We ideally want it to be no more than 6 hours old. And just within 30 minutes, if it's sitting out at room temperature, you can actually start to see changes within the cellular makeup. So some cells may die or lyse and burst open. Crystals may form. Bacteria could die. So a lot can happen. There are 3 primary ways of obtaining urine. There is a free catch, also called a voided sample, and ideally we want a clean or sterile container to catch the urine. We use a ladle at Independent Hill, so when we take them outside, we like boop with a ladle, always wearing gloves, and then from the ladle we can transfer the urine into the containers. We always use 1 to spin, and then we save 1 just in case we decide we need to run further testing. The downside of free catch urines is that you can have contaminants from the lower urinary tract, and it's really hard to use it for culture unless you have like a perfectly clean sample, or if you like clean the outside of the vulva and then do a midstream catch. Anytime you do urine from a litter pan, like for cats, it's very hard to get a free catch urine, although I do have some owners that do it fairly regularly, and I'm always very impressed because my cat would definitely not let me do that. But if you take a litter pan and you dump out all the litter and you clean it, and then we send home these little clear plastic particles called Nosorb, you can then put that in place of the litter, and then when the cat pees, you just dump the whole thing, the little plastic particles and urine, into a container and bring it back to us. Chances are, though, no matter how clean you get it, it's still going to have some bacteria or some debris that you may see. And the same thing can happen if you like suck up the urine off of a tabletop or off of a floor. So if they pee and then you use a syringe to suck it up, it can be contaminated with dirt and environmental bacteria. There's a cystocentesis, which is the ideal preferred method just because you use a sterile needle and a sterile syringe. You stick it directly into the bladder and then you suck out the urine. This is considered a sterile sample, and so you can use it for culture. If you are suspicious about issues in the lower urinary tract, so from the bladder to the exit, either for male or female, you're going to miss that. But it does let you ensure if there's any bacteria there or evidence of an infection, chances are there's actually an infection because you don't have the potential for contamination. You can also do catheterization, which is really only practical in male dogs. And it's a relatively clean sample. You insert a catheter through the penis into the bladder and collect the urine that way. Cats, if you're going to catheterize them, they need to be, especially male cats, they need to be almost under general anesthesia. Female dogs can be kind of tricky to catheterize, and female cats actually are very easy to catheterize, which you would think nothing about catheterizing a cat would be easy, but female cats actually comparatively are relatively easy. You still may get contamination with cells from the lower urinary tract. And if like you use lubricant, you could see contamination. We used to worry about the powder from the gauze, but we don't actually use the powder anymore, so that's no longer a concern. So now that we have our pee, we need to look at the pee. And so we look at the color. It should be normally yellow because of the presence of urochrome. If it's dilute, it's going to be pale or colorless. If it's really concentrated, it'll be anywhere from like an amber to like a really dark, almost orangey amber. And if there's blood, it's going to be cloudy red. If there's what's called hemoglobinuria, meaning you're peeing out hemoglobin, it's going to be clear red. And if you're peeing out bilirubin, then it's going to be a brown or an orange color. The odor, it's funny when you look up, describe urine odor. It mostly says fresh urine has a characteristic smell, but it doesn't say what the smell is. I guess we all kind of know what pee smells like. But if it's sweet, it could indicate diabetes. Like a really ammonia smell could either be that it's really concentrated or suggest that there's kidney disease. If it has like a putrid or foul smell, it's usually urinary tract infection. And the urine-specific gravity, that is a measure of the concentration, and that's one of the most important parts, is we want to know how concentrated the urine is. And it is compared to the concentration of distilled water, which is 1.000. And we use a refractometer to obtain the measurement. And normal is about, what's interesting is, like, you should say normal is 1.015 to 1.050, but instead we say normal is 1015 to 1050, even though it's actually 1.015. Dilute is anything under 1015, and that could be due to overhydration or kidney disease. If it's over 1050, then that can be due to dehydration. Sometimes just cats have really high concentrated urine, or if there's fluid loss. There's this thing called isostenuria, which is if the urine concentration is between 10.8 and 10.12, that usually suggests that there's kidney disease. And transparency, it should be clear, but sometimes you can see haziness or cloudiness, and that can be from mucus, cells, crystals, or bacteria. So next we do the dipstick. And the dipstick is an indicator strip that has multiple test pads on it, and you apply a drop of urine to each test pad, and then you wait like anywhere between 30 to 60 seconds. And the amount of time that you're supposed to wait per test is on the bottle. And then you line it up, and you don't want like the urine to touch from pad to pad. You line it up on the bottle and compare the colors. And then for each test, you use that scale to determine the value for each of those indicators. So we'll go through what is on the dipstick. And realistically, there's things we pay attention to, things we don't, things that we just classically have. So bilirubin is generally not present. However, you can sometimes see it in small amounts in dogs. It is always abnormal and always indicative of a problem in cats. If there is liver disease, bile duct disease, or hemolysis, then you can see it actually be fairly high. But a little bit of bilirubin is fairly normal in dogs. Blood, you generally want none, but sometimes you'll see very small amounts. And if it's high, it could be kidney infection, urinary tract infection, or trauma to either the kidney or the urinary tract. Glucose should be negative. If it's positive, then diabetes is one of the first things you think of, unless the blood sugar is normal, in which case it could be stress. It could be a recent ingestion of a high carbohydrate meal, some medications, and then there's some other less common diseases. Ketones are negative normally. If it's positive and they're a diabetic, that does indicate that they have diabetic ketosis. It does not necessarily mean that they're a DKA, because they have to be acidotic to have DKA. Starvation can cause ketosis. So if your body cannot utilize sugar, it'll break down fat for energy. And so if you're starving, you're going to break down fat, and then you're going to start peeing out ketones. And some high-fat meals can also cause ketosis. And you see it every now and then, just like no sugar in the urine, normal blood sugar, but they have ketones, and it's not really anything that we worry about. Leukocytes or white blood cells are usually negative, but if it's positive, it can indicate an infection. And nitrate, honestly, I personally don't really pay attention to it. It should be negative. If it's positive, sometimes it can indicate infections, but it's rarely. I don't think I've ever seen nitrite be positive. But to be honest, I don't pay attention to it a lot, so it's very possible that it could have been, and I just wasn't really looking for it. The pH is anywhere between 5.5 and 7. So 7 is neutral, and anything above that is going to be alkaline, and anything below that is going to be acidotic. And your diet is what directly affects your pH. So a plant-based diet is going to be more alkaline, and a meat-based diet is going to be more acidic. And then the last thing is the protein. And the protein should be negative. Sometimes you can have like trace protein, and that can be normal if the urine's really, really concentrated. But positive protein can indicate urinary damage, kidney damage, urinary tract infection, trauma, or cancer. But blood cells, red blood cells, can actually cause a false positive for the protein. So if we see that there